Okay, so this is baby Freddie. Freddie's had his stoma for a few days, and we're going to teach his parents how to change his stoma bag for the first time. So the first thing you need to remember is obviously to introduce yourself and explain what's happening, perhaps explain to the parents what the stoma is and what the stoma might look like. This stoma bag is opaque, but normally post-operatively you'll have a clear stoma bag, but it may be something smaller than this, but I'll show you some in a minute. It's clear so that we can do good post-operative checks of the stoma to make sure that the stoma is healthy and we can clearly see it. So the first thing I'm going to do is get my equipment ready. So obviously aprons, gloves. I'm afraid I haven't got an apron today. It's a non-sterile procedure. In the Trevor Mann baby unit, they will pretty much always use sterile water, but it's absolutely fine just to use tap water, but it is also okay to use sterile water. So the kit we need to get ready is fairly straightforward for a basic pouch change. So this is for a stoma that has no problems, and we're just doing a routine teaching. So we're going to need to have a waste bag to put the rubbish in when we've finished. And when the patients are at home, everything can go into this little bag and it can be put in the domestic waste. We need a little bit of water, don't need much. Nice warm but not too warm. Essential for pediatrics. An adhesive remover liquid. There are lots of different types, but this is the best one for children. One of these per pouch. Curvy scissors so you can cut your stoma bag to the right shape so it fits around the stoma properly. If you haven't already got a template, which the stoma nurses have cut, one of these is really useful. One of these is really useful to help us measure the stoma correctly. We need some soft wipes or gauze. Soft wipes are better because they're softer than gauze, and this is for cleaning and drying the stoma. We don't generally recommend wet wipes for this procedure. So the first thing we would do is we would empty the stoma bag. Often the stoma bags in paediatrics are on sideways because the babies are in bed and it's easier to empty. But the principle of emptying is very simple. There are two ways of doing it. Firstly, you can have a quill with a syringe on it so you can measure accurately the volume. And you would open the stoma bag. Always get control of the stoma bag, so gravity is helping you. Normally Velcro. Open the stoma bag from the bottom and use your syringe and quill to syringe out the fluid. This then needs to be measured and put on the fluid balance chart. Really good idea is to wrap a bit of toilet tissue round your finger and wipe inside, because that can go down the toilet at home, whereas the wipes can't. Again, make sure gravity is helping you and roll the stoma bag up. 1, 2, 3. Velcro. Velcro. Different stoma bags have slightly different closures, but the principle is the same. Really important to make sure the end of this is clean. If it's not clean, it will provide odour. So it's really important that you clean the end of this. And if you're emptying it into a dish and the bag is on sideways, quite often parents will do that, have a little yogurt pot at home, and they'll just roll the baby and empty it similarly, but into the pot. Make sure the end of the bag does not go into the bowel motion, because you will never get it clean properly. So you need to have good control of your stoma bag. Parents find the emptying actually very easy, not a problem. And generally, if we've taught them how to empty and they've got dexterous skills and they've got used to handling the bowel motion and tidying up, I find that actually teaching them the changing of the pouch is actually, they don't find it that difficult because they've had a little bit of practice already. We ask you to practice with your parents. If we ask you kind of every day really until they are confident in changing their bags. The ideal amount of time for a pouch change routinely is about 48 hours. So we kind of adjust that depending on how well the babies are. So we're ready to do our pouch change now. We've emptied the bag, we've measured it, we've documented it. So with our liquid, could be any other company, doesn't have to be this one specifically. We're going to start at the top of the pouch because we want gravity to help us, because this stoma may be working while we are doing this. So a little bit of liquid underneath. Okay, and you can warn the children and the parents that it might be a little bit cold. You could put it into a little bit of warm water, but you don't want it too hot, or just hold it in your hand. So this has come off nice and easily. Always a good idea to look at the back of the bag to see if there's been any leakage at all. So if there are scars or creases, you might find that you can see where the leakage is happening. It gives you a lot of information about problem solving. I then normally fold it in half, pop it in the bin, and we're ready to go. So a little bit of water. Make sure that you give it a really good squeeze, because you don't want water dripping all down the baby's tummy, because they don't like it. And then when you're wiping, you want to be quite purposeful, so you're going to wipe round. You're going to fold it in half, so you've always got a clean bit. You're going to wipe round again, fold it in half, and wipe again. And what you're trying to do is to remove the bowel motion from the skin without causing any trauma. If the stoma is a little bit bigger than some of the pediatric stomas, just make sure you get really underneath the stoma if it overhangs a bit, and clean around the stitches as well. Okay, once you've done that, you get one to dry. And again, you want to be fairly gentle but purposeful. So when you're teaching parents, you'll find that they'll be very anxious about hurting their baby. But generally, if they've not got sore skin, which can be very painful for babies, it's annoying for the baby and makes them cry and taking their clothes off and they're cold and cross. But it shouldn't be painful for the baby. So the next thing we're going to do is we're going to cut our template. So I'm going to get my measuring guide. And I'm going to take two measurements. I'm going to take a measurement from top to bottom. So that one's 15 millimeters, and I'm going to take a one from side to side. So this stoma is pretty round, around 15 millimeters. And this was not deliberate, but this stoma bag is already cut to 15 millimeters, so we're lucky. I'm going to check it to see if it fits. And in fact, it's a little bit small. So I'm going to get my scissors. I'm going to hold the bag away so I don't cut through the bag. And then with my curvy scissors that do not have a point on, if you have a pointed scissors, just be careful. I'm going to cut just up a little bit. And my recommendation is that you always use the angle of the scissors to cut rather than lots of little snipping movements, because you get a much smoother cut. So you're going to go round, and I'm just going to cut all the way around. And I'm turning the pouch as I'm cutting, and that gives us a really smooth shape. Don't cut through the bag. Rubbish in the bin. I normally just run my finger round just to make sure there's no sharp bits, and then I check again. So that's a little bit big, but okay. You want about 1 millimeter of skin showing around. If it's too tight, it can cause constriction, and if it's too big, there's skin exposed and the bowel motion can go on the skin. Always remember to roll up the bottom of the bag. Parents tell me they only ever forget once. Then this can be warmed up with your hand, or you can ask a parent to pop it under their arm or pop it under the baby, just so it gets a bit warmer. And then normally there is a release tab to peel off the backing. Now this is called the template. So this is really important, the template. So we will write the date that we've done it, the name of the baby, and we will make sure we keep that with their stoma kit so that the next nurse who comes along can check that the template is the same, and if it is, they can use this as a guide, and we'll be practicing that in a minute. So there are two ways to put a stoma bag on. One is the aim and fire method. So you hold your stoma bag, it's clear, you can see what you're doing, and you literally place it with the stoma right in the middle. Now that's really easy for us to do and really easy for patients, but as the paediatric children get older, they will start doing their own stoma care, so they may find the other method, making it into kind of like a half moon shape, lining it up underneath and then rolling the stoma bag up. And the position that the stoma goes on the abdomen is generally preference. So if a baby or a child is very sick and is in bed, we often have them to the side because they're easy to empty. If they're up and about and in bed, we might have it kind of 45 degrees, so we've got two options. But generally, normally they go straight down, and these can be tucked up and into the nappy, or they can be outside the nappy, no problem. When the stoma bag is on, just make sure you put a little bit of pressure around the stoma to make sure that you get a really good seal here, and then check all the way around that there are no creases, lumps or bumps, and just hold it over for a couple of minutes, warm it up, and then the new bag is in place. All the rubbish goes into the bag with your gloves and your apron. And generally we suggest that you get as much air out of this as possible, because this is going to go in someone's domestic waste and they may not be collecting it for a couple of weeks, so just make sure. And this can go in if they have a nappy gadget in their house, this could go in there as well. And then wash your hands when you're finished, tidy up, document what you've done in the care plan, and have a chat with the patient, the patient or the parent about what the next plan is, what we're going to do next. Okay,